I could just turn to Dr. Navarre and say, how do you use all this cost effectiveness information, such as what was just presented, in terms of actual decision making with your patients? Do you actually factor it in?
I think the reality of how we take care of patients in clinic is that a lot of it is driven by what the costs are to the individual patient, which is driven by what the payers are doing in terms of coverage, which is driven by the cost effectiveness. So oftentimes it comes into the conversation when I'm trying to explain why a medication is so expensive, or say, you know, we're going to start with ezetimibe because PCSK9 inhibitors are very expensive, and so let's see how low we can get your LDL cholesterol with this lower cost therapy first. So rather than talk about the specifics of the cost effectiveness, I do think that generalities around the cost of therapies and the potential value of therapies actually do resonate with patients, and people do want to know if a therapy is going to be worth it or not. And so I think it can be helpful when we're talking sort of generally about therapies, and maybe it's been really helpful when they incorporated that into the guidelines to help us justify the use of ezetimibe after statins instead of PCSK9 inhibitors, even though that wasn't what was tested in the trial. It has also been incredibly helpful that because icosapent ethyl is cost savings, I have found that when I prescribe it to patients, it's often approved by the payers, the copays are fairly low, and I think a lot of that is because of the payer interpretation of the cost effectiveness data has led to favorable coverage and cost sharing for the patients.
And maybe I can turn to Dr. Budoff and see, have cost effectiveness analyses in general, but now specifically the ones we're talking about here, PCSK9 inhibitors, icosapent ethyl, do they influence anything that you do?
You know, I think so. I think that the clinician understands enough, obviously not in the detail that some of the experts would, but I think they understand enough that cost savings or being highly cost effective is something that we need to strive for. I think we're being pushed by many different groups and our own practices to be more cost effective in how we practice. And if we can be cost savings, I think that has a huge implication for both the patients and for the healthcare in general. So I do think that this type of data is very impactful to the clinician to understand that this is something that's going to actually lead to saving money rather than further increasing our cost burden for healthcare.